This video will demonstrate the proper technique for treating the periorbital region using the small applicator. It is crucial to remember that when treating around the eyes, you must always treat over bone and never over the globe of the eye. After assessing the thin skin around the eye, position your patient comfortably. Instruct the patient to remain with their eyes opened and looking upwards. This will prevent gel from entering the eye. Apply a generous amount of ultrasound gel to the lower eye extending to the crow's feet area. Place the heel of your gloved hand in a piece of gauze over the cheekbone and gently pull the skin down away from the eye. The skin that you will be treating is now over bone and not over the globe of the eye. Start at either the medial canthus or the crow's feet area. While using very slow sweeping motions, move the applicator tip across the treatment area. You will want to treat in 2 rows as this will allow the skin to relax before the next pass. It is important to use gentle downward pressure to ensure that the applicator tip is in full contact with the tissue. The applicator tip must always remain perpendicular to the treatment area to avoid loss of contact of tip to tissue. Remember, you must always treat over the bone and never over the globe of the eye. It will be necessary to pause the treatment to reposition your gel. Your patient should feel intense heat but not pain. Instruct your patient to say stop if any sensation of pain is felt. When the patient says stop, reposition the gel. Often during the short pause in the treatment, the skin cools enough so that the patient can comfortably continue at the starting power settings. If the patient says stop again, then decrease the power in increments of 2 to 4. Your clinical endpoint will be the patient's report of intense heat as well as the erythema of the tissue. Next, treat the upper eyes. You will want to remove all gel from the lower eye area before starting the upper eye treatment. If you decreased your power settings while treating the lower eye, be sure to reset your power settings. With your patient's eyes closed, apply a generous amount of gel to the upper eyelid, extending to the crow's feet. Place the heel of your gloved hand on the brow line and gently lift the skin up and away from the eye. The skin you will be treating is now over bone and not over the globe of the eye. Move the applicator tip over the tissue using slow sweeping motions. You will need to reposition your gel during the treatment. Remember to use gentle downward pressure. The applicator tip must always be perpendicular to the treatment area to avoid loss of contact of tip to tissue. If necessary, pause the treatment and again, using the heel of your hand, lift the skin up and away from the eye. And you must always treat over bone and never over the globe of the eye. You must always consult the treatment settings guide for appropriate treatment parameters.